The World Health Organization has announced that it is phasing out using the name monkeypox for the disease. The move comes after years of complaints that it had racist connotations and played into stigmatizing language. The virus is now called mpox, but both names will be used simultaneously for a year until mpox is fully integrated. So for more on the name change and also how it impacts the medical industry, I want to bring in Dr. Jay Varma. He's the director of Cornell Center for Pandemic Prevention and Response at Weill Cornell Medicine. Thanks so much for joining us. First off, in the summertime, we were talking an awful lot about monkeypox, and there was concern as to whether or not there were going to be enough vaccines, and there was concern about cutting the dose of the vaccine in order to extend it. Cases have severely declined from back in the summer months. Why have things changed? Where are we now?
Great. Yeah, thank you for having me. At least as far as the United States is concerned, we're at a much better place in the epidemic. One of the most important reasons is that very early on, people who are most heavily affected, that is gay, bi, men who have sex with men, and people in their sexual networks, changed their behavior. The second thing that happened was people got vaccinated, especially those who are in the highest risk group. And the real challenge becomes right now here in the US is that the virus isn't going away. It's going to likely settle into a lot of the places where we see a lot of other sexually transmitted infections. That is a lot of marginalized communities. And it's also not going away globally, where there isn't really the same access to vaccines as there is here.
So what have we learned about monkeypox and how it spread since the summer?
I think one of the most important things we've learned is that to get these really explosive outbreaks, and I don't just mean, one person giving it to another person, but rather one person gives it to another person who then gives it to other people and on and on and on. That really seems to be associated with sex. We don't know if it's sexual fluids or whether it's just the close skin contact that comes during sex, but we know that's probably the reason why, at least for the moment, it's primarily been associated with people in, gay men and people in their sexual networks. It doesn't mean it couldn't spread elsewhere, but that's one thing. The second thing we've learned is the vaccine does appear to be very effective at helping reduce people getting severe illness. The big uncertainty is we don't know whether that's protection for the lifetime or that's the short term. And we'll know more as we go on, and that'll have a lot of impact on what we see here in the United States and the rest of the world.
So quickly, let's talk about this name change, mpox. I can see why there would be complaints about the original name. But in a medical context, what does the name change mean? What does it look like?
Yeah, I mean, for the average, physician, this doesn't really change anything at all, right? I think what we all know in public health, and we've certainly seen during COVID, is that medical names and medical issues are also part of a larger social and political dialogue, right? And we know that for a very long time, people with black skin have been called names associated with monkeys. So it makes sense from a sort of social perspective. Scientifically, it also makes sense. This is actually not a disease that's associated with monkeys. It just happens to be the first time it was ever detected was in monkeys. So for scientific reasons, it doesn't really make much of a difference as well to change the name. It's perfectly accurate to change the name.
We said that it was going to sort of take a little while for the changeover. I mean, does anything sort of significantly need to change, or is this just about getting the word out that it's called something different now?
Yeah, from a scientific perspective, there are some issues. You always, you want to be able to search scientific literature and look for it. And so, I mean, I do think that one can expect that within scientific circles, a lot of people will continue to use both names. But when it comes to the way people like myself and others who are communicating publicly, over time, the name will change. And this has, happened before. We no longer call, a disease called rubella. We no longer call it German measles. We no longer refer to the 1918 flu as the Spanish flu. So changing names so that they're not stigmatizing is actually something that is very common. This is not a new phenomenon, what WHO has chosen to do.
All right. Dr. Jay Varma, thank you very much.
Thank you for having me.